1. A certified dialysis nurse is preparing an educational module for adult learners on vascular access care. Which approach best incorporates adult learning principles? A. Using lengthy lectures with minimal interaction. E. Encouraging self-directed practice with guided feedback. C. Requiring rote memorization of access site steps. D. Presenting only written policy documents. 2. During evaluation of a new dialysis nurse's performance, which method best measures both technical skill and critical thinking? A. Written multiple-choice test only. B. Direct observation with a structured checklist and reflective questioning. C. Peer evaluation without structured guidelines. D. Self-assessment without mentor input. 3. When creating a curriculum for patient education on fluid restriction, which principle of adult learning is most essential? A. Adults learn best when content is abstract and theory-heavy. B. Adults need irrelevant details to build memory connections. C. Adults are motivated when learning solves real-life problems. D. Adults retain information only when memorized repetitively. 4. A certified dialysis nurse is mentoring a novice nurse. What is the best way to promote clinical judgment development? A. Providing all answers directly during patient care. B. Encouraging reflective questioning and case-based discussion. C. Limiting practice opportunities until mastery is shown. D. Using only simulation and no real patient exposure. 5. Which evaluation method most accurately measures competency in infection control during dialysis? A. Unstructured peer feedback. B. Supervisor observation with a validated skills checklist. C. Patient satisfaction survey. D. Self-reported compliance logs. 6. When aligning dialysis training modules with regulatory compliance, which should be prioritized? A. Accreditation standards and CMS regulations. B. Learners' preferences over mandated policies. C. Only organizational traditions. D. Instructor convenience. 7. During a patient education session, a certified dialysis nurse notices the group is disengaged. Which strategy reflects effective adult learning principles? A. Continuing the session without changes. E. Incorporating real-life patient scenarios into the teaching. C. Extending lecture length to emphasize importance. D. Providing only written instructions afterward. 8. A dialysis training curriculum must be revised annually. Which factor best ensures compliance and quality? A. Outdated reference materials. B. Current evidence-based practice and updated CMS guidelines. C. Nurse trainers' personal preferences. D. Historical program outlines. 9. A certified dialysis nurse uses formative assessments during preceptor training. What is the primary benefit? A. Measures only final learning outcomes. B. Identifies learning gaps early for targeted support. C. Eliminates need for summative evaluation. D. Focuses only on regulatory compliance. 10. Which communication technique best facilitates conflict resolution between a dialysis nurse and patient? A. Active listening and validating patient concerns. B. Ignoring patient emotions and focusing only on tasks. C. Using medical jargon to assert authority. D. Limiting communication to written instructions. 11. When evaluating a dialysis nurse's ability to manage emergencies, the most effective strategy is A. Closed book, written test. B. High-fidelity simulation scenario with structured debrief. C. Case study reading assignment. D. Open group discussion without assessment. 12. Which mentoring technique is most effective for supporting a struggling dialysis nurse trainee? A. Constructive feedback with clear, achievable goals. E. Criticism without follow-up support. C. Assigning more tasks without explanation. D. Avoiding feedback until the final evaluation. 13. In patient education about dietary restrictions, which adult learning principle is key? A. Adults benefit from learning irrelevant theory. B. Adults learn best when content connects to personal experience. C. Adults prefer only passive listening. D. Adults cannot apply learned concepts independently. 14. Which of the following ensures that a dialysis nurse training program is in compliance with regulatory standards? A. Documented alignment with CMS and state board requirements. D. Informal oral guidelines only. C. Reliance on peer tradition. D. Excluding evaluation of patient safety protocols. 15. A certified dialysis nurse is tasked with creating test items for a training program. Which item type best assesses clinical reasoning? A. True-false recall questions. B. Multiple-choice case-based scenarios. C. Fill-in-the-blank definitions. D. Matching vocabulary terms. 16. In adult learning, self-efficacy is crucial. Which mentoring practice fosters this in dialysis nurse trainees? A. Allowing independent practice with guided reflection. B. Discouraging questions to avoid time delays. C. Assigning tasks without feedback. D. Correcting only errors without acknowledgement of strengths. 17. A dialysis nurse trainer is using evaluation methods to measure patient education effectiveness. Which tool is most effective? A. Random informal conversations. B. Pre- and post-education knowledge assessments. C. Nurse's subjective opinion. D. Observation without documentation. 18. When developing dialysis training materials, what factor best enhances retention for adult learners? A. Interactive, problem-based learning modules. B. Memorization-heavy written manuals. C. Instructor-led reading sessions. D. Passive video watching without feedback. 19. A certified dialysis nurse leads a workshop on regulatory compliance. Which strategy ensures meaningful engagement? A. Role-play scenarios involving CMS compliance issues. B. Reading aloud CMS guidelines word for word. C. Independent silent reading. D. Memorization drills only. 20. Which evaluation strategy ensures validity when testing dialysis nurses on vascular access skills? A. Structured return demonstration with a skills checklist. B. Self-reported confidence survey. C. Patient's anecdotal feedback. D. Random verbal questioning. 21. A certified dialysis nurse is mentoring a new hire. Which feedback style best supports professional growth? A. Specific, timely, and constructive feedback. B. Generalized comments weeks later. C. Negative criticism without solutions. D. Avoidance of feedback to reduce stress. 22. Which principle should guide curriculum development for certified dialysis nurse continuing education? A. Integration of evidence-based practice and adult learning principles. B. Reliance only on historical teaching methods. C. Exclusion of learner needs in content planning. E. Prioritizing trainer convenience over learner engagement. 23. In assessing a dialysis nurse trainee's communication with patients, which evaluation method is most effective? A. Structured role-play assessment with observation rubric. B. Written multiple-choice test only. C. Patient self-evaluation form only. D. Informal peer discussion. 24. When designing a patient education session, which teaching strategy best aligns with adult learning? A. Case studies and problem-solving discussions. B. Memorization of textbook passages. C. Teacher-centered lecture without interaction. D. Listening without practice opportunities. 25. A certified dialysis nurse preparing for recertification must demonstrate ongoing competency. Which method is most appropriate? A. Continuing education credits and skills validation. B. Informal verbal assurance. C. Peer recognition without documentation. D. Patient compliments. 26. Which mentoring technique fosters critical reflection in dialysis nurse trainees? A. Asking open-ended clinical reasoning questions. Providing all correct answers immediately. C. Discouraging reflective discussion. D. Focusing only on task completion. 27. A certified dialysis nurse is leading a competency workshop. Which evaluation method ensures fairness and reliability? A. Standardized rubric-based assessment. B. Instructor's subjective impression. C. Informal verbal questioning. D. Peer voting system. 28. During a dialysis nurse training session, participants show different learning preferences. Which strategy best addresses this? A. Using multimodal teaching approaches, visual, auditory, kinesthetic. E. Delivering only written material. C. Requiring identical note-taking for all. D. Sticking only to lectures. 29. When evaluating regulatory compliance in dialysis units, which method is most effective? A. Structured audits and documentation review. B. Informal walkthrough without checklist. C. Staff self-reporting alone. D. Patient complaints only. 30. Which communication approach best promotes patient adherence to dialysis treatment plans? A. Motivational interviewing techniques. B. Using medical jargon to demonstrate expertise. C. One-way communication through handouts. D. Ignoring patient concerns.